said, it's really neat to see the audience exponentially increasing each year, so wonderful to have you here. I'm really pleased to be able to introduce our keynote speaker, Dr. Joti Samra. One of the privileges of doing introductions is you get to read people's bios, and you know, at some point you think, well, I'm going to stop getting impressed, and then you read someone like Joti's and you continue to be impressed. Joti is particularly appropriate today when I look at her work and our theme of knowledge translation, because I think what she's done very effectively is take her work and communicate it in a tremendous way to both leaders of institutions and to the population. She is an innovator in psychological health and wellness in the workplace. And her research has really catalyzed fundamental improvements in the psychological health and safety in workplaces throughout Canada. She uses her research to become a passionate, and has become an incredibly passionate advocate for change in a variety of settings. When you look at what she's done, some of the key concepts that I really love was she's developed something called Guardian Minds at Work, which is an online resource that is used by employers to address psychological threats in the work environment. She's also been the principal developer of something called Managing Emotions, which is an online interactive set of assessment and training resources that strengthen the interpersonal competence and emotional intelligence skills of managers. As a result of her expertise, she sits on a number of provincial and national advisory committees on workplace psychological health. As well, she has a busy consulting practice. She's also been very active as a faculty member, and as a result of her tremendous contribution, she's been the recipient of the BC Psychological Association's Advancement of the Profession of Psychology Award. She's also very active in TV media and has had a number of roles in terms of advising and promoting media throughout. So it's my pleasure really to welcome Joti today and to hear what she has to say about women, mental health, and the stigma of mental illness. So please join me in welcoming her. Thank you.
Thank you so much, Gina, for the very kind introduction. Now, I want to make sure I'm not, no one's hearing me double, so I'll move that out of the way. Is the audio okay from the lav mic end of things? Do I need that? Well, I have a mic on here. Okay. Oops, already not listening to instructions. Okay, well, thank you so much. Thank you to Dr. Brado and to the Women's Health Research Institute for inviting me to be here today. And thank you to the attendees for taking time out of your busy and demanding schedules to open your minds and hearts to hear about research and important issues when it comes to women's mental health. I'm very honored to be able to be standing here to kick off today's symposium. You have a fantastic lineup of very accomplished speakers that are here today that will be addressing a breadth of topics that are relevant to all of the work that all of you here do as clinicians, as researchers, and as health decision makers in our province. Now, to start out with, what I'd like everyone to do is close your eyes. Okay, so everybody in the room has to do that. Okay, and I'll do it kind of myself. I won't look up. I want you to close your eyes and keep your eyes closed until I tell you to open them. I'm going to ask you a series of questions. And as I ask these questions, I want you to raise your hand and just leave your hand up until I'm finished. The first question is to all of the women in the room. I know the bulk of our attendees here are women, so women only. I want you to raise your hand and leave it up if you have ever had assessment, treatment, or a diagnosis for a mental health condition. Now, men, I want you to raise your hands if you are currently or in the past have ever had a female partner that has had assessment, treatment, or diagnosis for a mental health issue. Okay, now for all attendees, men and women, I want you to raise your hands if it's not already up if you have a mother with a mental health issue. And you're welcome to use your other hand if there's going to be two things that you meet criteria for here. Okay, I want you to raise your hands if you have a sister who's ever received assessment, treatment, or diagnosis of a mental health issue. I want you to raise your hand if you've ever had a daughter that has dealt with mental health issues. Now, more broadly, I want you to think about whether there's been any female in your life, caregiver, friend, coworker, colleague, someone that you love, care about, that cares about you, and is a critical part of your life that has met criteria for a mental health diagnosis. Now, you may also have women in your life that are important to you that maybe haven't formally met any kind of criteria. Perhaps it's even yourself. But we know that many of us as informed health providers, researchers, decision makers have awareness when we're struggling. And so raise your hands if perhaps you think there hasn't been any formal connection to a mental health system, but you're quite certain that someone you love or care about or yourself has likely had a mental health condition. Okay, and I want everyone to open their eyes now. And I know we only have 2 arms. I wasn't going to ask you to raise anything else, but just take a look around at the room, right? All of us are impacted, and all of us are impacted in many, many ways. And if you haven't yet to date been impacted, you just haven't gone through enough life experiences. And as I always say, all of us will be impacted if we live long enough and go through enough life experiences. And so this issue of women's mental health is relevant to all of us. And my slide is not clicking. Nope, I'm hitting the green arrow. There we go. And so as we look around, and I mean, I'm just really struck by the amount of impact that all of us have. Every audience that I go to, every group that I speak to, no one will say that they have no experience with mental health issues among people that they love and care about. Now, my aim today in 20 short minutes is to present some compelling stats to you on the prevalence rates of mental health issues among women, discuss some of the reasons for the elevated rates that we see, which can help inform the research and clinical work that we do, and to address some of the ongoing contributions to the stigma that surrounds mental illness for women, and some of the unique reasons why some of the sources of that stigma are very unique to women. Next slide, please. Now, I'm of course a woman, so I have gone through my life with the perspective of a woman and have been exposed to the range of barriers, challenges, fears, anxieties that everybody in this room will have known, all the way from when we're very, very little. Those of you that are parents or have children in your life know the range of concerns that are very unique to women. And I'll touch on some of those. And some of those stats were already presented by the opening speakers, or in the opening comments this morning, about rates and exposure to risk of trauma, certain kinds of abuse, sexual abuse in particular, sexual assaults, different kinds of victimization. We're generally not as strong as men are, and that exposes us to certain kinds of risks. And so we are wired in a way that inherently there are, and likely always will be, some element of unique risks that we're exposed to as women. Now, as a researcher, I am certainly well aware of the plethora of research that describes the unique elements, challenges, barriers, differences in treatment approaches that exist for women. And certainly as a practicing clinical psychologist, this is something that I see every week. The challenges that women are faced with based on different demands, workplace barriers, workplace-related issues, the demands of working and being in what's called a sandwich generation, dealing with elder care demands, dealing with childcare demands. And if we look at the research, we know that women still tend to bear the bulk of home care responsibilities in spite of very kind of exponentially rising in their role as breadwinners within families. And all of these things matter when we're understanding what factors impact our mental health as women. And not only do we need to pay attention to women's mental health because of the high rates of prevalence of mental health issues and the impact on their individual lives, but also because of the wide-reaching impacts that we know this has on society more broadly. And so when women are struggling and when their needs are unaddressed, not only is their own personal quality of life impacted, but there's a ripple effect on our communities, on our children, on our elders, on our workplaces, and on men in our society. It's important to understand that the prevalence rates of mental health issues, independent of sex or independent of other demographic factors, is tremendously high. The World Health Organization now, as of this year, 2017, identifies depression as being the leading cause of worldwide disability. Okay, the leading cause of worldwide disability. And this is important to consider because there's often this assumption, particularly when it comes to mental health and psychological health, that maybe it's a first world problem or a North American issue, or that we're kind of creating kind of more of these issues than we need to because of some of the luxuries and niceties that we have in our society here. But this really is a worldwide burden that is associated with depression. Canadian statistics indicate that per annum, the prevalence rates of mental health issues, again, across the board for men and women, is 1 out of 5. So if you look around at your table, I mean, we have about 4 to 5 to 6 people at each table. That means at least one person, if we just go on stats, at your table right now, will deal with a mental health issue this year, okay, just this year. And that's only looking at conditions that would be diagnosed. We know that lifetime prevalence far exceeds that, and conservatively, the estimates indicate that 50% of individuals will meet criteria for a diagnosable mental health condition at some point in their life. And my feeling is that's a gross underestimate. And again, we live long enough, we go through enough life experiences that all of us, perhaps we won't walk into the office of a psychologist like me, maybe we don't go talk to anyone outside of our inner circle about it, but we will struggle at some point in our life with a mental health diagnosis. And so from an absolute number standpoint, the global burden of mental health issues is tremendous. And keeping this in mind underscores how impactful it is when we consider that for women in particular, that across many of the primary mental health conditions, depression and anxiety in particular, that the rates are even higher than the rates that I'm presenting to you. Women are more likely than men to meet criteria to be classified as having certain mental disorders. So in particular, depression and anxiety. And as already addressed, depression is the leading cause of disease burden. It's notable that this applies to women in both high income as well as low and middle income countries. According to the World Health Organization, depression following childbirth affects 20% of mothers in low and lower middle income countries, which is even higher than previous reports that we've had from high income countries, which certainly has been a surprise to me. These are some quite recent stats that have come out. We know that women are also more likely to report using antidepressants. Now, certainly this may reflect the higher rates of depression that we see. There are also higher rates of help-seeking behavior in a positive vein that we see with women. So women are more likely to go to doctors, talk about their difficulties, seek help from a therapist or a psychologist, and so that does confound some of the numbers that we see. We know that at the present time, anywhere from 9 to about 17%, so 1 out of 10 to about 1 out of 5 women, depending on their age, are current users of antidepressants, and that's 2 to 3 times the rate for men. Now, every year, there's an estimate of approximately 800,000 individuals that die by suicide globally. The majority are men. I just felt another mic just came out. Are we okay? Yes. However, there are exceptions, and we know, for instance, in China, where the suicide rate in rural areas is higher among women than men. And importantly, we know that attempts for suicide are grossly greater for women. So suicide attempts exceed death by suicide at a rate of about 20. So we know that for every one completed suicide, there's about 20 suicide attempts. And we know that in general, suicide attempts and other related self-harm behaviors are exponentially higher for women than they are for men. And that really constitutes an unrecognized burden of disease and disability and impact on quality of life. Now, comparatively, when we take a look at rates of substance use, so alcohol as well as other drugs, women are less likely to be classified as meeting criteria for alcohol or drug abuse or dependency than men are. However, if we look at the numbers, and these again are likely an underestimate, that we know that lifetime rates of alcohol abuse and dependency among women are 13%, and you can see the rates here for other drug use, marijuana 5%, and other drugs 4%. And again, we know that this is looking only at a diagnosable disorder, and we know that rates of what's called hazardous drinking, so drinking not necessarily to the point that you're meeting criteria for a disorder, but drinking at a level that's higher than what health guidelines would suggest, affects at any given time about 10 to 20% of the population. And so again, we know that the impact of substance use is still in absolute numbers significant for women. Now, stress, right? We often hear this word stress in our society. It's become kind of one of these words that we hear or use daily, perhaps multiple times a day. And people will often say, stress, stress, stress. We hear about stress in our society. Does it matter? Is it important? Are people just too focused on, kind of the negatives? What is it that's leading people to contribute or talk about stress in such a kind of heavy, ongoing way? And we know that stress matters. Now, first of all, we're wired in such a way that we are built to deal with stress. We're wired in a way that we deal with stressors, small little stressors, right, throughout the course of a day, running late, the alarm doesn't go off, you spill coffee on the shirt that you just put on as you're walking out the door, someone cuts you off on traffic, while you're driving to work in traffic. These are kind of small stressors, and we're equipped very well to actually deal with those. And we're actually very good as human beings at dealing with acute stressors and also kind of stressors that might impact us for longer periods, days or even weeks, sometimes even months. But we know that when we are under chronic stress that's unrelenting and it's above what the kind of reasonable person is able to tolerate, that has very significant impacts on our health. And in fact, it makes us twice as likely to develop a diagnosable clinical disorder, in particular anxiety or depression. And so chronic stress and understanding what stressors look like becomes very important when we take a look at the trajectory of mental health conditions and how they develop, and also what we can do in a positive way from a prevention standpoint. Now, StatsCan data indicates that about a third of women will report most days of their life as being quite or extremely stressful. So not a real surprise, right, really, to any women in the room. But you think about that, to have a day-to-day experience where the perception of stress is quite or extremely high is significant and is impactful. And these rates are higher than rates that men report for overall stress. Today, more Canadian adult women report perceiving their own mental health as just fair or poor. These rates are higher than they were 10 years ago, so we see that things are going in a negative direction, not in a positive direction. And furthermore, more Canadian adult women today, when compared to 10 years ago, report being diagnosed with a mood disorder. And we see increased rates across all age groups. And the absolute numbers, again, are higher than they are for men across all of the age categories. Oops, go back here. When we look at women that are in the workforce, that about up to 34%, so again about that third category, who have worked in the previous 12 months, will say that they perceive most days at work as being quite a bit or extremely stressful, with reported work stress generally being common and higher than it is among men. And although links to specific occupational roles have not been kind of well identified yet, we know that there's certain occupational sectors where rates of stress are higher across the board. It is notable that our Canadian data is indicating that women are becoming increasingly represented in select occupations, specifically relating to social science, education, and government service. And they tend to rate across all of these sectors their work stress as being higher than men do in the same occupation, right? So all of this it kind of raises flags for us to say, let's examine this more and let's understand. We know that certain, say, even high risk or high stress work environments create kind of generic stressors and pressures on all individuals, but why is it that we see women in identical roles, in identical positions, in identical occupations that are still consistently reporting higher levels of stress than their male counterparts? So important research questions for us to keep examining. Now, why do we see these differences in rates of mental health issues across the board? And the answer is there's multiple reasons. Now, some of these differences are related to the way that women cope with stressors. Now, when coping with negative events, as women, we tend to internalize our emotions much more than men do. So through social withdrawal, through rumination, right? The mind that just keeps on going and going and going, and through self-evaluation and comparison. So these attributes are all very unique to women, and we see that consistently women are much more likely to engage in internalizing coping behaviors, which when we take a look at the kind of evolution of mental health conditions such as anxiety and depression, that internalizing component, that rumination, that kind of excessive comparison to others really plays an important role in terms of the trajectory of how these conditions develop and then also get maintained and exacerbated over time. The fact that women can bear children matters. So a recent meta-analysis showed that 1 out of 5 mothers in developing countries experience clinical depression after childbirth. 1 out of 5. And this is in developing countries. Now we know, of course, that virtually all women are at risk for developing, the potential for developing a mental health condition in that, particularly the first 3 to 6 months postpartum, and really in that kind of first year after delivery. But we know that elements such as poverty, migration, extreme stress, exposure to violence, domestic, sexual, gender-based violence, emergency and conflict situations, natural disasters, low level of social support, that all of these are factors and elements that impact women in developing countries, but also when we take a look at the ethnic fabric of our wonderful country, Canada, we know that we have many women that are coming in various kind of capacities as refugees, as immigrants, as first kind of generation women that are still feeling the impacts of factors that maybe don't exist in such an acute basis in their society or life here in Canada, but that they're bringing with them. And those impacts are important and they matter tremendously when we're understanding women and mental health. And we know that from a household and family care perspective, as I already alluded to, women are still much more likely to be primary providers of childcare and elder care and other household responsibilities. And this is even when we correct for breadwinner status. So we know now, depending on the age group that you're looking at and whether, so age group in particular, that women now comprise anywhere from on the low end 25% to about 40% of households where they're the primary breadwinner. So we're quickly, and the estimates are telling us that very quickly women are going to be getting to the 50% plus mark in terms of breadwinner status. And that will happen soon. If you look at the stats, it's happening very exponentially, and we see likely within the next decade will certainly kind of match or even exceed in terms of breadwinner status. But when you consider that in light of the fact that figures also tell us that about 80% of elder care and child care responsibilities continue to be borne by women, that's significant. And it helps us to kind of raise hypotheses about why workplace stressors, for example, have such an important role, why chronic stressors continually are reported as being higher and persistent and pervasive than women are. And we need to understand from this broad perspective all of the factors that impact women and their mental health to really be able to design effective intervention supports, effective community supports, effective healthcare supports, and research that helps us get there. Now, stigma. Stigma for mental health issues and toward mental health issues continues to be a pervasive issue in our society. It's changing. We have seen lots of gains in a positive way, particularly over the last decade when it comes to awareness and understanding and representation of mental health issues in the media, but there still is a tremendous amount of stigma that exists toward individuals broadly with mental health issues, and self-stigma, so that negative kind of perceptions towards oneself. Now, stigma, which very broadly means having fixed ideas and judgments about people, as well as fearing and avoiding that which we don't understand, includes both negative attitudes, okay, so the kind of attitudes and beliefs that we hold, as well as negative behaviors toward people with mental health issues and mental illness. Now, stigma very broadly can include the use of negative language, right? So things like psycho, calling someone nuts, crazy, victim blaming. So statements like it's all in your head, look at all the great things in your life, implicit or explicit reminders of being different in some way or weaker in some way, workplace-related stigma, and then perceptions as well about individuals with mental health issues as being dangerous, or on the other hand, kind of lazy or weak. And these are very kind of common, prevailing areas of stigma that we see toward mental health issues. And so it's pervasive, and we also know that there are some unique areas of stigma that impact women very uniquely. So there are often unjustified concerns regarding whether women with a mental illness are able to safely and effectively raise a child, or whether they'll ever get it together enough to be able to have or raise a child. And this is a very pervasive and very specific area of stigma that impacts women with mental health issues significantly. There's also what might be called benevolent stigma, so where women in particular with mental health issues are much more likely to be treated in condescending ways. So like a child being approached with a baby voice, overly kind of over concerned, but in this way that's kind of really condescending and giving the impression that she's weak or unable to take care of her own issues. And we know that this kind of benevolent stigma can be well-meaning, but often is misguided and unhelpful, and at worst can be harmful. We know that general stigma toward mental illness has interaction effects with issues that women already face in many workplace sectors. So for example, an anxious woman's non-dominant status in a work environment may be reinforced by stigma about anxious people in general, and women are much more prone to be bearing, whether it's perceived or actual, kind of stigma in work environments and decisions around promotion and hiring, and kind of changes in responsibility in their workplace. And this interaction effect with mental health issues is something that's certainly worthy of ongoing attention. We know that there are gender stereotypes regarding the proneness to emotional problems in women, and these appear to continue to reinforce the social stigma and constrain help-seeking behaviors. So the idea that, women are just emotional, or she's just crying, or she's just, she's just, and we can fill in the blanks on kind of the thoughts and stereotypes that come along with that. But we know that that kind of stigma is a barrier to accurate identification and treatment of psychological health conditions. Violence-related mental health issues among women can often be difficult to identify, largely due to stigma and fear of judgment. And so women are still reluctant to disclose a history of violent victimization or psychological trauma, even when they're asked very pointedly and directly about it, even in healthcare environments. And this kind of relates to and ties in with the final kind of area of shame and stigma, which is cultural related. And so we know many women from a range of various kind of cultural and ethnic backgrounds continue to face high levels of shame and stigma about even acknowledging weakness, being able to disclose that they have a mental illness. And so all of those barriers really impact how those illnesses develop in women, and also how likely they are to seek help and get treatment. Now, in closing, it's highly critical that we as researchers, as clinicians, as health decision makers are mindful of the unique issues and factors that impact women's health and the factors that impact continuing and ongoing pervasive stigma. In doing so, not only do we make important impacts on the lives of individual women, but we have a broad-reaching impact on our community. It's helping our mothers, our daughters, our sisters, our aunts, our grandmothers, and our friends, has a very direct impact on our society as a whole. Thank you kindly for your attention. It's been a pleasure being here, and I hope you enjoy the rest of the day. Oh, and we're doing questions.
That was a tremendous overview, and I think has really sort of painted the landscape for us and a really clear presentation of the realities for women and mental illness. So thank you very much for that. We have time for about 2 questions. So if folks have questions, perhaps they could stand, and there's a microphone over there and microphone here. So we have time for about 2, so folks have questions. Yep, there's 2 microphones. Anyone? Maybe I can just ask you then, from a policy perspective, and given your sort of work in the your work and specialization in the workplace, what would you say are the top 3 priorities in terms of research, women's health research, in terms of the improving the workplace situation for women with mental health issues?
Great question. So, the top 3? Is that what you... I get 3, okay. I mean, one, it really is when we take a look at kind of work environments is, and this is kind of non-specific to women, is we still have a tremendous way to go in terms of just having dialogue about mental health issues. And so being able to have an understanding, have an awareness, and talk about it in an open way. And when I say that, that doesn't mean that we all walk into workplaces and disclose every kind of itty-bitty detail about our life, right? That isn't what the suggestion is. And I say that because that often is when I work with employees in a range of capacities, but I work a lot with employers as well. And so often the kind of fear people will have is saying, oh, does this mean everyone's going to kind of air every part of their personal life in a work environment? And I'll say, no, that's not at all. But it's to create an environment, and through that, workplaces, I believe, bear the responsibility and have an onus to provide education. And so as a starting point, just even educating about some of the facts and figures that you've even heard this morning, that's an important starting point, because often people don't know. And people don't know, and I see this in lots of kind of different isolated capacities where individuals will say, you know, I don't know, that's just, she seemed busy, she seemed like she was just managing, she seemed, and I hear much more of that in a clinical setting toward women than I do toward men, interestingly enough. And so I would say one is awareness and explicit attention that's put on understanding the unique factors that exist for women in a work environment. Number 2 would be starting to understand the continuing barriers that we do have, particularly in select sectors that have been traditionally male-dominated: academia, emergency response, police services, fire. Those would be kind of ones that come to the come top of mind for me right now, and those are work environments where we see increasing rates of women that are in that work environment, but we still don't have a good understanding of the ongoing barriers that are continuing to exist, and more importantly, even effective interventions that can help kind of buffer the challenges for women in some of those unique environments. And I think that's 2, but I'll stop there.
One question.
Great. Just one more question.
Hi, thank you so much for your talk. My name's Allie Carter, and I'm a PhD candidate at SFU, so I know the experience and impacts of stress intimately in my own life. And I also have a grandmother and a sister who live with bipolar. So I know the topic personally, and I also work on it professionally. So I'm a feminist epidemiologist working with women living with HIV who are not only impacted by the stigma of HIV, but the stigma of mental illness. Depression in our cohort is, over 50% of the women in CHIWOS have depression and anxiety. So the one piece about your talk that really stuck with me was when you talked about how higher rates of mental illness among women are in part due to the way in which we internalize our emotions and self-evaluation, et cetera. And you said that those were really unique to women. And I think that's important for two reasons. One, it gives us some insight on what we can do to prevent mental illness in the first place. But two, I think an alternative sort of way of looking at it is that not that those things are unique to women, but that we're socialized to be that way. And in turn, the impacts of that, are things like depression, anxiety, et cetera. So given, that alternative way of thinking about it, and that we're socialized to, self-evaluate and internalize our emotions, et cetera, what can we be doing in our own lives and also with women at a really young age so that we socialize them to engage with their emotions differently and, in turn, hopefully prevent the impacts that you've talked about?
Well, thank you. First of all, thank you for the important work that you're doing, and yay, another awesome woman that's going to be doing great work in this world. And I would agree with what you're saying about that kind of the internalizing style, that socialization is a big component there. And I do believe education is key to that, and I believe education starts when kids are young. I mean, I would love nothing more than every child that's going through school to have education around how to cope with stress and manage depression and anxiety, the two most kind of pervasive psychological health problems that impact us. And so I think it's education, and I also think it's targeting men in particular. We know if you take a look at kind of initiatives that exist, I can send some to you. I'm not thinking of ones off the top of my head right now, but there are different kind of programs that I've kind of learned of or heard of kind of over the years that are very much targeting men, and they're often done with high risk, say, male population. Maybe there's been a history of violence, particularly kind of in domestic situations, and there's education on that end, and I think that is a key part that loops into helping us say, how do we kind of at a more at a broader level be able to impact these issues of socialization. So start with kids that are young, and also very much focus on men in our society as well from an education standpoint.
Thank you. I'd like to say also thank you for a wonderful presentation. And I'm going to speak not as an elder and educator, but as an educator, as a frontline warrior. And I bring the voices of people that are living with this. And I noticed that you use the word drug abuse and alcohol abuse. I'm a former drug user. I never abused drugs. I used them to the best of my ability. Abuse is a very stigma and condescending word, and if I can educate when we're working with people that have lived this life, we don't need any more stigma. And I also live with HIV and face a lot of stigma and discrimination. And if we can just change our language to drug use, I would be very appreciative. And I thank and honor you today.
Thank you.
So thank you very much for the questions, and thank you again, Joti, for that wonderful presentation. I'm going to ask Lori to join me on the podium right now, and we have some special presentation.